Hello, my name is Dr. Sarah Stainthorpe, and together with Dr. Caitlin Moore, I want to present to you my poster and quality improvement project, Advanced Level Escape, an educational escape room for the advanced practice nursing student. The reason why I chose this project is due to the recent shift in the nursing education landscape from a traditional concept-based teaching framework to a competency-based framework, as outlined by the American Association of Colleges of Nursing 2021 New Essentials. Given this change, faculty such as myself are tasked with developing competency-based activities for students to ensure curriculum standards are being met. One way for students to achieve competencies is through the use of gamification. Educational escape rooms are a type of gamification that have been widely used in undergraduate nursing education, showing that they are effective teaching tools that help students demonstrate competencies of teamwork, communication, and clinical judgment, which are essential to nursing practice. Literature also shows that educational escape rooms are a fun way to learn course content and provide a psychologically safe space for learning. There's limited literature, however, on the use of educational escape rooms in advanced practice registered nursing education. The purpose of this QI project was to evaluate an educational escape room as a competency-based educational tool in advanced practice nursing education, specifically evaluating the competencies of communication, teamwork, and clinical judgment as outlined by the American Association of Colleges of Nursing New Essentials. The study design was a cross-sectional quantitative pre- and post-test design involving 117 students from a family nurse practitioner and adult gero primary care nurse practitioner program. The activity was an educational escape room involving a medically complex older adult patient recently discharged from the hospital to home. Groups of 6 to 8 students worked together to complete 7 complex challenges as part of a transitional care management visit within a 50-minute time frame. After the activity, a survey was administered which asked participants to rate their level of agreement using a 5-point Likert scale related to AACN, APRN competencies of teamwork, communication, and clinical judgment and reasoning. Additional questions related to whether the educational escape room was enjoyable, took place in a psychologically safe environment, related to course content, and an optional open-ended question response was also asked. Results were overwhelmingly positive. Over 80% of the participants somewhat agreed or strongly agreed with all 12 survey questions. The open-ended question responses were also very positive. An interesting finding was that when compared to demographic data, it was found that those with less than 5 years of RN experience had a statistically significant higher ratings of the educational escape room than those with 5 to 19 years of experience, which could be related to generational learning differences, but that's something to explore in the future. Overall, this QI project helps close the gap seen in the literature and supports the use of educational escape rooms as a competency-based education tool in advanced practice nursing education. Thank you.